Hi, good morning and welcome to my channel. I'm Dr. Carmen McGuinness. I'm a board-certified behavior analyst and a psychologist. I present here on Sundays on topics pertaining to relationships of all sorts, including the relationship we have with ourselves, the most important relationship of all. So today, my topic is to present on the distinctions between psychopaths, sociopaths, and narcissists. And you might ask why this particular topic. It's heavily covered on the internet. In fact, if you're here watching this, you're probably interested in this topic and have perhaps seen dozens of presentations on these distinctions. However, as you'll see when I get started, I'll be addressing the distinctions between psychopaths, sociopaths, and narcissists from several different directions. For instance, I'll discuss how these folks are created, what causes a sociopath or a narcissist. I'll discuss their motives, their style of attachment to their parents, which also impacts their adult attachments, their self-image, what they actually make of themselves, and how to spot them from their narrative, and the pivotal part of resilience in the development and the course of these personalities. So a little bit more in depth than possibly some other presentations that you've seen, I hope. And so let's get started. I'm covering this topic because so many clients ask me questions like, was my violent father a sociopath? Is my wife a narcissist? And as a therapist, I focus on the client as much as possible and not on the players in their lives. This can be difficult. It's a struggle for all therapists, and it's something that we all work very hard to do. But we also have to recognize that it can be supportive of processes like forgiveness to be able to give it a name, whatever it was that was the problem for those players in our lives, at least loosely. And please understand that we're not talking about diagnoses of any sort. I don't do that. I don't diagnose anything, in fact. And we certainly shouldn't try to diagnose anyone who's not in the room. But we're just talking about guidelines here to help people understand what happened to them. And then I also ask that you understand that all of the traits that I'll discuss here today exist on a spectrum. Just because someone is self-centered doesn't mean that they're a narcissist. And not all bullies are sociopaths. And not all cold-hearted, guiltless liars are psychopaths, believe it or not. These people actually exist in very low percentages in the population. There's a lot of bad people out there, but there's not a lot of narcissists, sociopaths, and psychopaths. So they may be people you need to stay away from, but they're not diagnosable necessarily. So this video is not meant, I'll just repeat myself, as a diagnosis of anyone. As I already mentioned, it's simply a guideline. So, leaping in, perhaps the most outstanding trait of these individuals, all three of them, is that they lack empathy. And this means that they really do not understand how you feel. How you feel has a purpose for them, and they may like or hate or be ambivalent to how you behave, but they don't care how you feel. How you feel is a mystery to them, and they just don't care. They don't give a damn. It's only important to them in regard to how you feel makes you behave, and only how you behave in relation to them. So that's the connection there between understanding how you feel, empathy, and caring about how you behave. The importance of this empathy, this lack of empathy, cannot be stated strongly enough. It is empathy more than any other trait that makes us truly human, connected, sharing, emotionally available to those who love us and need us comes from empathy. So again, all three of these lack empathy. A related question I often hear is, are they born that way or are they created? So let me explain. Sociopaths and narcissists are created through their development, while it's widely accepted that psychopaths are born, and some theorists reckon that they are either born or created very, very shortly after birth. So let's look at each in turn. The narcissist is a product of a failure to bond appropriately with a loving caregiver. The parent is probably not abusive or unloving. They're just not emotionally available to the child. The mother may have been a narcissist herself or simply fatally distracted by life. This can happen through illness, depression, marital or other relationship difficulties, divorce, or other sorts of abandonment, poverty, unemployment, which of course can result in poverty, but it's also just plain distracting, or overwork. A parent who is so busy, maybe keeping down 2 or 3 jobs, or has a brilliant career and really isn't that emotionally available for the child. And this is the young child. This is the infant and the young child when narcissism begins to emerge. Whatever the cause, the child fails to develop a healthy, secure attachment. This is not the child who is insecure and clingy. In fact, that's the person that the narcissist will later attract in their romantic relationships. Instead, this is the child who adopts a dismissive attitude toward the parent. Oh, well, I can take care of myself anyway. I don't really need you. In contrast, the parent of the sociopath is likely abusive. Either that or they somehow fail to support the child or teen while abuse is being delivered through some other element of the environment. Perhaps a bad crowd at school or a dangerous neighborhood, often a step-parent. Through repeated exposure to this sort of threat and abuse, in the absence of a supportive parent, the child or teen, and this can happen in the teen years as well, eventually becomes inured to this sort of abuse and emerges with sociopathic traits. Though both are incapable of empathy and both are emotionally avoidant to their family, friends, and lovers, these two present a little differently. The narcissist learns to fit in, to give society just enough of what we expect to get back what he needs, which is, of course, attention. In contrast, the sociopath walks a fine line between normal and rage. He may exist on the fringes of society, finding it difficult to maintain a job, a relationship, and often a home. He may just be a hot-headed fellow or woman, or he may be involved in organized crime. Both are dangerous. The emotional detachment seen with both the developing narcissist and the developing sociopath will in time emerge into what we call the avoidant attachment style in adulthood. And again, these traits exist on a spectrum. Not all avoidants are narcissists or sociopaths, but all narcissists and sociopaths are avoidant. What this means in an adult relationship is you may get love-bombed and then ghosted a week later, a month later, or 3 years later. And for me, with my clients, what I find is the worst kind of ghosting is when it's just emotional. When the person is still present in your life, but they've emotionally shut you off and moved on to other relationships you're not aware of, this can be the most painful because it lingers. There's no way to get over it. The psychopath, in contrast to the above two, is believed to be born, or as I said, some theorists believe that they emerge shortly after birth. It's hypothesized that there's a critical failure of the areas and pathways of the brain that house normal empathy, and hence we get the psychopath. Another distinction is that psychopaths and sociopaths fall more on the psychotic versus the neurotic side of the spectrum, versus narcissists who veer toward neurosis. And this is often a surprise to clients that I discuss this with, because they think their narcissistic partner or friend or parent was very confident, overconfident, in fact. But in reality, these people are very fearful. They have a low self-esteem. They don't feel that they're worthy. And the way that they get any kind of self-esteem and worth is through the people around them. They need our admiration. They need our attention in order to feel loved, in order to feel worthy, in order to feel like they have any value at all. So the distinction between psychosis and neurosis, other than what I just mentioned, is the ability to experience guilt and shame. This is a big distinction between the two. Shame is a public experience, I should explain, versus guilt, which is felt as a private emotion. So if a sociopath is made to feel guilty or presented with someone attempting to shame him or her, he will probably lash out and rage. That's how they respond to that. Versus a narcissist who may actually feel bad about, say, cheating on his wife, for instance. Now, I'm not saying he's going to let it stop him. It won't stop him. But he may feel bad, at least for a little while, especially if the possibility of public shame is involved, because his image is everything to him, as I mentioned. And this gets us to the topic of their motives. The motives of these three differ very greatly. Psychotics have criminal motives. These are your sociopaths and your psychopaths. They have criminal motives. Even if, in some cases, a sociopath might not have criminal motives, but they engage in criminal activities because they don't know how else to get things. And, of course, there's that rage. In contrast, narcissists are motivated by attention and what I call controlled drama. They don't necessarily, they might lose it and hit somebody, a wife usually, but they're not usually criminals. They like controlled drama. They like drama that they create and they have a handle on. In fact, control is everything to the narcissist. And this brings us to the next distinction, their narratives. The narcissist had a brilliant childhood. He will tell you, he or she, that nothing was wrong, everything was perfect. In fact, it was better than most people. Just like he or she is. Life was good. His motive? To get your admiration, of course, to get your attention, to notice him, to think that everything about him is brilliant, or her. Versus the sociopath who will tell you all about his or her rotten childhood and his dangerous stepfather, or how she or he was beat up by thugs every day on the way home from school. All of which, by the way, might be true. These people are less likely to lie about their childhood than the narcissist. In fact, in many cases, we find that narcissists don't even remember much about their childhood. But it was all good. They'll tell you it was all good. Versus, as I say, the sociopath who just wants your pity. So he or she is going to tell you how rotten his or her childhood was. So as you viewed this, you may have wondered, why does one person become a narcissist or a sociopath when another becomes a social worker, a teacher, a minister, or just a regular guy that doesn't hurt people? Well, resilience is the variable that's been credited with miracles in regard to both mental and physical health. It's not genetic resilience, but rather it's learned from surviving painful experiences while maintaining optimism and hope. It's perhaps 10% individual constitution and 90% fortune. If you are fortunate enough to realize the lessons within the experience, you just might have the resilience to develop empathy and a healthy sense of shame and avoid a life as a narcissist or a sociopath. So I hope this was helpful. I really believe that a healthy understanding of the distinctions between these sorts of people versus, of course, typical people that we want to be involved with in our lives is important to all of us. It helps us veer away from more dangerous relationships and experiences. So I hope you found this helpful, and I hope you have a wonderful Sunday and a really fabulous week, and I look forward to seeing you next Sunday. Thank you for stopping by. If this was helpful, please give me a thumbs up. Thank you.